Mom and I realized very quickly how thankful we were for the services, the institution, the people here at the Chatham-Kent Health Alliance. My name is Deborah Furlan, and I've been a lifelong resident of Chatham-Kent. Not born here, but virtually all my life raised here. Both my parents are from England. My father was a school teacher here in Chatham-Kent, starting off at John McGregor Secondary School, and then at Chatham-Kent Secondary School, and retiring there, and then went to St. Clair College as a part-time professor teaching the nursing students. And I had just finished picking up some mums from the GUIs on St. Clair Street, and brought them back to St. Vincent School, and was just parking when my younger brother Derek called. And it's not a call that I have not heard before, because my dad has Addison's disease, and he's often gone to the hospital, and he's a bit of an adventurer too, so he's landed in emergency rooms actually all around Canada because he just has that adventurous spirit. But it is a call where you immediately have my attention, and I was within 5 minutes of the hospital. I met my mum and my sister-in-law Andrea and Derek in a little room off the corridor of the emergency room, past the red button gated entrance, and sat there but a brief moment. And then Dr. Dixon and a nurse came in to give us an update status on Dad.
We received a call from the emergency medical services saying that we were receiving a patient that was VSA. That's the terminology that the EMS services use for somebody that's had a cardiac arrest at their home or place of work and are coming to the emergency department with no vital signs. Hear that pre-alert, we have a process where we assemble our team. There are usually 3 physicians involved, nursing staff, respiratory therapy, our lab, x-ray, registration, so that we're ready to receive the patient and to make our best efforts to attempt to reverse what's going on and try and save their life. The paramedics were doing chest compressions and helping his breathing, and we received the story from them and then quickly carried on with our process of attempting to resuscitate. There was no family there at that point, which is often the case, but several of our nursing staff actually recognized this gentleman as Mr. Shepherd, who is a very prominent member of the community, who was involved as a teacher for many years, and in fact had not only taught some of our nursing staff, but had taught many of their children. Our resuscitation proceeded, and we had some response in terms of able to restart Mr. Shepherd's heart. And at that point, probably about 20 minutes into the resuscitation, I was told that his family were here. From our point of view, from a medical standpoint, it seemed very unlikely that he was going to survive this event, but at that moment in time, his heart was beating. He was trying to breathe by himself. As the leader of the team, I went to meet with the family.
So I just remember Dr. Dixon giving a status and hearing him say, "Come in." And we're working on him actively. We've restarted his heart, then it stops, and then we restart it again. And we have a whole team working on him, and just come in. And I remember just hearing "come in," thinking, "Oh, you don't have to ask me twice."
We do have a process where we bring family members in during resuscitation. Even though it's very traumatic for them, we know that it helps in the long term if the family members see the extent of our efforts to save their loved one. It helps with their grief. It helps with understanding the process of emergency medicine, and it helps them understand the effort that we put in as a team to try and help the person that they love.
And I think it was Rebecca, the nurse, that was just like, basically cautioning us in a very kind way, like that it's very busy. There's a lot of activity, probably a lot of buttons and whistles and sounds going on around Dad, but for us just to focus on him. And so I just remember my body like propelling me, like just wanting to move off my chair and past Dr. Dixon and head right into the trauma center where they were working on him. And I just saw Dad. I really didn't see anything else. I think everything else just was white noise to me. I just went over to Dad's head. And being with him is something I'll never forget. I think it was such a special time for all of us. And I loved whispering in my father's ear, and I could feel him respond, even though I know physically I think he was immobilized by all the medicine and whatever else that was happening. But I think what Dr. Dixon did was acknowledge right away that there was so much more happening. Throughout that hour, I don't even know how long it was, we would get little commercial breaks with Dr. Dixon where he'd kind of pull us aside and give us an update. The first one was, I suppose, more positive, more hopeful, that if they could stabilize him, they would move him to Windsor and I think do an angioplasty or something like that. And then we'd go back to Dad and we would just talk to him and be with him. Mom reminded us all that Dad did not want any extra care beyond anything too intrusive, and we all knew that. And then I think Dad crashed, and they restarted CPR, and we just knew. I remember Dr. Dixon announcing the time of his passing, which was 12:36, and by then I think we all actually just accepted it. The team did everything that they could. We were in shock. It was a very sudden experience for us. Those that know Mr. Shepherd, he always likes to go out with a bang, so his death was no different. Dad would be very proud of the service that he received. In fact, I know he would. And at one point, Dr. Dixon talked to my husband and I out in the hallway. And he said he has a very strong team of nurses, and that at least 4 of them were crying because they had been taught by my dad. I would want to say to Dr. Dixon and his medical team, thank you. Thank you for probably having the courage. I think any of us who work for big corporations and administrivia, we get all the policies and rules and regulations, and I don't know if there's a policy for that, but it was the right thing to do at the right time for the right reasons to bring in the family. And I'm sure it's a risk, and I'm sure even in my own family we all react in a different way, but I couldn't imagine being told that I couldn't see my dad. And there was no resistance. It was an immediate come in and be with your family. So a tremendous amount of credit goes to him and to his staff for taking that risk, that leap of faith to allow people on the construction site basically that maybe don't have the hard hat and whatever else, but need to be there and need to be in the room and help, because I think that's what caring is all about. So thank you very much.